The World Health Organization recently admitted that coronavirus is airborne and updated its public health guidance with this statement on how the SARS-CoV-2 virus is transmitted. A person can be infected when aerosols or droplets containing the virus are inhaled or come directly into contact with the eyes, nose, or mouth. The virus can also spread in poorly ventilated and/or crowded indoor settings, where people tend to spend longer periods of time. This is because aerosols remain suspended in the air or travel farther than 1 meter long range. WHO's statement explains why it ended up being wrong about how coronavirus spreads. It distinguished between droplets and aerosols, then assumed only what WHO considers to be an aerosol can fly far enough to be called airborne. At first the distinction seems clear-cut. Droplets are like cannonballs fired by a cough or sneeze that fall to the ground within 1 to 2 meters, whereas an aerosol airborne solution is made up of respiratory particles that are released when you speak or breathe, and can linger in the air like smoke for several hours. If SARS-CoV-2 only spread via droplets, interventions that reduced the risk of catching and transmitting the disease, like social distancing, through the 2-meter, 6-foot rule, and washing hands could have been enough to slow the spread of the COVID-19 pandemic. But if the virus were transmitted via aerosols, face masks would be needed too. And as we now know, masks are necessary. Both droplets and aerosol particles consist of microscopic spheres of liquid, and scientists distinguish between them based on the size of those tiny globules. Droplets and respiratory particles are many times larger than SARS-CoV-2. Each virus particle, technically known as a virion, is 0.1 microns wide, 0.1 micrometers or 0.0001 millimeters, and the distance it travels, before it disintegrates or settles on a surface, is influenced by the size of its surrounding globule. Making a distinction between droplets and aerosols is essential in experiments, as researchers must control as many variables as possible to measure the effect of changing one. But results from a laboratory don't always apply in real-world environments, where aerodynamic behavior is affected by factors like airflow from natural ventilation, which may help a droplet float more than 2 meters. Describing a virus as airborne according to the size of a globule suggests a level of precision that simply isn't relevant outside the carefully controlled conditions of a lab. And so while there's technically a difference between droplets and aerosol particles, practically speaking it might not matter. In relative terms, droplets are big and aerosol particles are small. But in absolute terms, the line between them is determined by an arbitrary threshold. Historically, health authorities like WHO and the Centers for Disease Control have used a cutoff of 5 microns, the width of E. coli bacteria, to separate droplets from aerosols.